Today we're here in Johnson City at Karing Hearts Cardiology, and I'm joined by Dr. Dan ORourke, Dr. Jeff Schoondyke, and Dr. Schoondyke, your practice here, it's expanding and getting better all the time.
Absolutely. Over the last 5 years, the community has been really good to us, and in the last probably 6 months, we've added 4 new doctors,
Right.
Dr. ORourke being one of them. Really have had just a great response from the community, and we're just here to say hey and hopefully continue that pattern.
Well, I want to turn here to Dr. ORourke, and Dr. ORourke, you said you were in Pittsburgh, you came back here, you made it around, but you're back here in Johnson City.
Yes, sir, that is correct, and it's a pleasure to be here with Karing Hearts Cardiology, and it's a great opportunity, especially in the latter years of my practice career, to be able to have this opportunity to participate with Dr. Schoondyke and the rest of the team.
Talk about your practice here. What are you accomplishing here?
Okay. Generally, we have a full-service cardiology practice here. We offer all the standard modalities, heart catheterization, angioplasty, stents, but we also do a lot of, as you mentioned, vascular imaging. We do a lot of heart imaging through echocardiography and nuclear stress testing. We also do a special type of nuclear stress test called PET imaging, which is fairly unique in the outpatient setting, especially in a private practice, but it is considered a very valid and very expert modality for the diagnosis of coronary heart disease, and we do offer it right here at Karing Hearts.
All right. Another thing that they offer here is a great vascular program, a new vascular program.
You bet.
Tell us about what's going on with your new vascular program.
Well, over the last probably 18 months or so, we've been able to actually fine-tune our skills and do a lot of vascular work. People that have heavy legs, their legs hurt when they walk or when they're laying down at night, we can actually image the arteries and the veins in their legs and actually see if that pain is caused by a blood vessel problem.
Right.
And right here in the office, we can take care of that with a non-invasive procedure. Just requires a small little needle stick, and it's not that painful. And it fixes them up very nicely. Our response has been really great from a lot of patients.
And let's talk about, you're offering a special right now. If folks tune into this segment right here and say that they saw this segment, you're going to give them some specials here. Talk to us about those.
Absolutely. You call the office or walk in and say, we heard the vascular screen on the TV. We'll do it for absolutely nothing, free.
Let's talk about that vascular screen.
You
What
got
does
it.
that entail?
Basically, all it is about a 15-minute ultrasound where
Right.
we look at the veins and the arteries in your leg. We'll put some blood pressure cuffs on your legs and make sure that the flow both from your heart and to your heart is adequate. And if it's not, we can talk about it.
All right. And Dr. ORourke, I want to talk to you because I want to know, this is a very important screening that folks need to have done, isn't it?
Yeah, it's venous disease is much more common than we realized, and a lot of people who have had occupations where they're on their feet a lot, hairdressers, people who use jackhammers, construction workers, teachers, those types of people, and a lot of women are affected by this years after childbirth. A lot of venous disease occurs there, so it's a very common problem. It is not life-threatening, but it can be very lifestyle limiting, and
Right.
patients can have very significant symptoms, and the success rates with these procedures is quite high.
All right. And Dr. Schoondyke, you're an independent office here.
You got it.
What does it mean to be independent and have a cardiology practice like this?
You know, we are the only independent practice
Right.
in the entire Tri-Cities now. What that means is that we have the flexibility to make decisions very quickly. If our patients need something, we can be there. We can sort of steer the ship very quickly. It really allows us the personal control to take care of our patients the way we like to take care of our patients, and that's always putting them first.
All right. And talking about those patients, say a patient has some symptoms, they want to come in for that vascular screening. Talk to us about some of those symptoms that they need to be looking out for.
The big things that people will find is that their legs feel heavy when they're walking around. They can have some pain. Say they walk up a flight of stairs and their legs or their calves or their thighs, sometimes in their buttock area they can feel some pain. A lot of people who have some vascular problems, when they go to bed at night, their legs will feel tired, they'll ache. Sometimes you'll see people with varicose veins that are very painful. So those are the major things that people should look out for. And Dr. ORourke's exactly right. Those occupations that you're on your feet all day, I mean, it is really a big problem, and we can give you some very significant symptom relief.
And the price is right on
Absolutely.
this.
You can't beat free.
You can't beat free.
That's
All
right.
right, Dr. ORourke, Dr. Schoondyke, thank you so much for sharing this with us. It is a great opportunity. If you're feeling that heaviness in your legs, it is a great time to come in here to Karing Hearts Cardiology here in Johnson City.
The preceding portion of Daytime was sponsored by